Welcome everybody. Good afternoon and welcome to our special funding announcement information session. We'll give it a few more moments to allow some more folks to join us, and we'll try to get started as soon as possible. Looks like the room is filling up, so that's a good sign. So stay tuned. We'll get started very shortly. For those who are just joining us, we'll get started very shortly. Just giving a couple more moments for more folks to arrive, and just want to welcome you to our CDPH special funding announcement and information session. Thanks for joining us. All right, looks like we're about at our RSVP amount, so I want to welcome everybody to our CDPH special funding announcement session. My name is Ryan Skaggs. I'm a program consultant with the CDPH Office of Oral Health, and I'm pleased to announce the launch of our request for applications for our next 5-year flagship grant. It's called Moving California Oral Health Forward, and the grant period will be beginning July 1st, 2022, and it will run through June 30th, 2027. So the information today is about our request for applications. I want to thank everybody for joining us. So we're excited to announce the extension of our local oral health program, Prop 56 funding, into the next 5-year cycle. During today's information session, we'll explain a little bit more about how our next 5-year cycle will continue to help implement the strategies of the California Oral Health Plan to improve the oral health status of all Californians. For this funding opportunity, all 61 California local health jurisdictions and their designee agencies are eligible. So currently, in the last 5-year cycle, we've been working with 59 California local health jurisdictions, and we've invited 2 additional local health jurisdictions today, and we're hoping moving forward, we can hopefully expand to all 61. A little bit of information about this grant is that it is non-competitive. So all complete applications that we receive will be considered for final funding awards. And so we hope that that would not be a barrier for all those who wish to apply. So with that being said, we want to start out today's session with a message from our California Dental Director, Dr. J.S. Kumar. He could not make it today, but fortunately he was able to record a presentation about our next 5-year grant. So give me just a moment and we'll get this playing.
Good morning. I want to extend my welcome to you to this webinar. We have good news on the COVID front in California. Cases are down. There are new antiviral drugs under review that brings new hopes to put this pandemic behind us for the next year. So this meeting is to announce the availability of a funding opportunity to continue local oral health programs for another 5 years. The current cycle that began in 2018 will end in June 2022. So we want to give you sufficient time to submit the application to avoid interruption in the services. The purpose of this grant is to continue to assist each of California's 61 local health jurisdictions or their designated agencies in the development or expansion of their programs as stipulated by California Health and Safety Code sections. In 2018, when we were working on this initiative, we had a skeletal staff. Today, I'm proud to say that we have a team of program managers, contractors, contract managers, research scientists, and support staff and technical assistance center. Putting together a funding opportunity announcement takes many hours and many meetings with several administrative units within the California Department of Public Health. I want to thank my team for working diligently to go over the lessons learned, the application process, and the work plans. I want to thank our partners. They were instrumental in getting the funding. This year, our partners were able to obtain the backfill for the funding. This means any reduction in tobacco revenue will not affect our $30 million allocation. Out of this, we are allocating $18 million for the local oral health program grant, or 60% of our investment. Our partners will be asking questions about our portfolio, about our investment, about our programs. We have to show progress and be accountable for our actions. We made some progress with respect to assessment, community engagement, and developing community oral health improvement plans. However, we had difficulty implementing interventions because of the COVID-19 pandemic. Moving forward, we want to focus on eliminating children's oral health disparities. We have effective interventions at the individual level and community level. As a result, we should be able to make significant improvements in preventing tooth decay. School-based programs and school-linked programs, community water fluoridation, toothbrushing with a fluoride toothpaste, reducing sugar intake, increasing dental visit rates, encouraging kindergarten oral health assessment, and improving oral health literacy are the key elements of our program. We have established several targets in the California Oral Health Plan. These targets require us to focus on pregnant women, young children, and school-age children to make progress. The goal of the local oral health program is to support the infrastructure and capacity to provide foundational public health services such as assessment, policy development and support, communications, building partnerships, and implementing evaluation and performance activities. The Tobacco Tax Initiative requires us to focus on education, disease prevention, community clinical linkages, and surveillance. The grant funding should be used to prioritize underserved populations and areas with the greatest oral health needs. Local oral health programs are expected to implement the strategies outlined in the California Oral Health Plan and make progress towards achieving the California Oral Health Plan's objectives. The desired outcome is to reduce oral health disparities, especially among school-age children in California, by 50% by 2030. At a minimum, grantees will promote, coordinate, facilitate, and evaluate school dental programs in targeted elementary schools and link children to a source of dental care. In this grant, there's a target to implement school dental programs in at least 50% of eligible schools. You will hear more details about the funding opportunity announcement today. Thank you. I hope you'll have a very productive meeting.
All right. Well, thank you, Dr. Kumar, for recording that and giving us a little bit of an introduction today. Give me just one moment here. So again, I think Dr. Kumar mentioned that today's information session is to cover the application process for the next 5-year grant. So it will be very broad in general, but we will definitely have a lot of time at the end of today's presentation for a question and answer period with the Office of Oral Health. So please feel free to utilize the question and answer box to type any questions that you might have either during the process of going through these slides in this presentation, or at the very end when we allow some time for question and answers. We want to make sure we try to address everybody's questions if possible today. Also, and a little bit further on in today's presentation, we'll talk about some information sessions and office hour sessions that we'll have coming up that will allow more time to be able to connect with the Office of Oral Health staff if you have any questions in working on either the application process or the budgeting process for our next 5-year grant. So I just want to make everybody aware of the Q&A box today, and please feel free to utilize that, and we'd love to answer any questions that we can today. So again, as Dr. Kumar mentioned, the purpose of this funding is to support the development or expansion of local oral health programs. So again, we want to create and expand the capacity at the local level to educate, prevent, and provide linkages to treatment programs. And as Dr. Kumar mentioned in his presentation, that there was some delays due to COVID in implementing intervention. So, you know, looking forward into the next 5-year period, we're hoping to implement more interventions and support program activities related to oral health in communities, such as education, disease prevention, building community clinical linkages, and oral health surveillance. Again, we really want to improve the oral health of all Californians, especially by prioritizing underserved areas and underserved populations. All work plan activities are intended to support a 50% reduction in racial ethnic disparities and oral health outcomes among school-aged children in California by 2030. So that's kind of our big picture goal, is you know, really looking at some of the current inequities that we've seen around the rates of caries experience, untreated caries, still placement, things of that nature. We'd like to see you know, 50% reduction in those disparities. Our funding mechanism for issuing these funds will be a subvention and local assistance grant. So essentially what we're doing is, you know, really continuing the work that had been done in the past 5 years and moving it forward into our next 5-year grant funding cycle. Although our grant is intended for local health departments, in instances where local health departments may not be able to house the local oral health program, we may consider designee agencies. I know right now we work with First Five and a local department of education. So if there are instances that a health department declines funding, we're hoping to look for alternative designee agencies within California jurisdictions. The CDPH will review all applications received and will create new contract numbers and produce contract documents for jurisdiction signature. Local approval processes tend to vary quite significantly. So I'm recommending right now that you really do a lot of research into your own approval processes in your department and what you might be required to execute a new grant. Typically, local health jurisdiction board of supervisors approval is required. So please look into your own approval processes, and if you expect it to take a while to get on your board of supervisors agenda, please try to build this into your timeline. And we recommend doing this as soon as possible. Local health jurisdictions who accept funding will develop budgets for their supplemental submissions. So our budget submission will be due a little bit after the main application period, which will give you a little bit more time to plan your budget. And again, we're looking at a July 2022 to June 2027 implementation period. This is a process map of what a typical application process might look like. One of the things to note is what you see towards the right, request an agenda item on a Board of Supervisors meeting. This might look different for different jurisdictions. We may be working with jurisdictions that could even potentially require Board of Supervisors approval for our letter of intent. We understand that, you know, we work with right now 59 different jurisdictions and, you know, a lot of different ways of doing things. So please just let us know if you have any special requirements for Board of Supervisors approval. A couple major things to note are a letter of intent. We're hoping it's non-binding, but we're hoping to get one from everybody. And so please, try to let us know as soon as possible whether or not you decide to accept funding. And one of the things I touched on earlier is that we are hoping to add 2 additional local oral health programs to our grant. So we'll be defining really what a legacy local oral health program is. And for those folks who have been accepting our grant funds and had a contract with us, the 59 jurisdictions that we currently work with, you will be considered a legacy oral health program versus the 2 jurisdictions which we do not currently have a contract with. Those will be considered newly establishing local oral health programs. So a lot of the work that we'll be doing in this new 5-year cycle is essentially continuing to build upon the work that had been done in the first 5-year cycle. And so for legacy local oral health programs, you'll want to take a look at the grant activities to really take a look at what your requirements are. And our current new work plan will have objectives. They'll have 7 objectives, and all legacy oral health programs will be responsible for implementing all objectives. So I know in the past, we did have, different requirements for implementing objectives. And obviously, some of the smaller jurisdictions, we're responsible for implementing less activities. This time, we're just hoping to build on a lot of the progress that was done in the previous 5 years and continue implementing a lot of the same activities that were foundational in the first work plan. Whereas newly establishing jurisdictions may be responsible for implementing objectives 1 through 3, which are more foundational objectives. And then they will be responsible for implementing 1 additional objective, and they can select those from objectives 4 through 7. And we can go over those more, but you'll really want to take a look at Exhibit A to get a good idea of what those reporting and tracking measures are, as well as the work plan appendix that we have sent out. And these are our Tier 1 jurisdictions. These are agencies that are projected to receive funds less than $200,000 per year. So for those of you who are in this tier, you'll notice that your funding has not changed since the previous grant. One notable difference in this funding tier is the addition of Inyo and Napa counties, which we are not currently contracted with. And those will be, our legacy programs will be responsible for implementing all objectives 1 through 7, whereas if we do end up working with Inyo and Napa, they would be responsible for implementing objectives 1 through 3 and 1 additional objective of their choice from objectives 4 through 7. Here we have funding Tier 2. These are agencies projected to receive funds more than $200,000, but less than $700,000 per year, and this funding tier is unchanged. Again, our legacy programs here will be responsible for implementing all objectives 1 through 7, as well as our Tier 3 jurisdictions. They will also be responsible for implementing all objectives 1 through 7, and our Tier 3 agencies receive funds more than $700,000, but less than $900,000 per year. And Tier 4 is Los Angeles County all to itself. As many of you may be aware, Los Angeles County is by far the largest jurisdiction in California, and is also the largest county in the United States. So they receive more than $900,000 per year, and they will be responsible for implementing all objectives 1 through 7. Here's the timeline of our key milestones. So today our guidelines were released, and today we're also having this informational webinar. We have an office hours session coming up on October 27th, 2021. And we encourage all jurisdictions who have questions or encountering difficulties completing their applications to attend that session. On November 5th, our non-binding letter of intent is due. So while it is not contractually binding, we are asking everybody to do it when possible. So please let us know if you have any encounter any difficulties, whether it's getting permission to complete a letter of intent or requiring Board of Supervisors approval. Just want to reiterate that it is non-binding, but we're asking LHPs and jurisdictions to complete it. The application, except for the budget, will be due on December 15th, 2021. And following that, we will begin our application review process. As I mentioned earlier, we have a second supplemental submission for our budget items. So we have an extra month and a half for that planning. We'll have another office hours session on July 12th that will really focus on that supplemental submission. So we also encourage folks to attend that office hours session. If they're encountering difficulties in their budget planning or any other items following that, by March 30th, we hope to have all of our contracts ready for agency signature. And we'll have our supplemental submission review and approving work plans and budget in our period between April and June 15th, with the target July 1st, 2022 for executing all grants. Again, please try to review your agency's approval process and build that into your internal timeline when considering these items and what it might take for your jurisdiction to complete an application. So I just want to give you a little bit of a crosswalk between some of the items on our old work plan and that we've been implementing over the past 5 years, and how they relate to the objectives on our work plan for the next 5 years. So in the table on the next slide, you'll really see the relationship between our legacy work plan and our new work plan. Our objectives in our previous work plan, we had 11, and they've been consolidated into fewer numbers. And again, as I had mentioned, legacy oral health programs will select all of the objectives, and new oral health programs will select objectives 1 through 3 and 1 additional objective. And I think what you'll see is that a lot of the basic foundational objectives and activities in the work plans has remained unchanged. I think what you'll just really see is a more deeper level of implementation. So our 2022 objective number 1 is composed of objectives 1 through 5 in the 2017 work plan. And that, those activities include building local infrastructure, needs assessment, CHIP, and evaluation plan. And for those who have been our legacy oral health program, you won't necessarily need to complete a major overhaul of those plans. You might just need to revisit them and update them during the 5-year period. In our 2022 objective 2, that will focus on building community clinical linkages, school-based and school-linked programs, and fluoride. And in our objective 3, you'll see COHA and key partnerships. So in our 2022 work plan, objectives 2 and 3 are really going to be very big key implementation areas, and some of the objectives that you might see the biggest changes. And we'll go into that in a little bit more in, I believe, the next slide. Our 2022 objective 4 is the 2017 objective 8, which has to deal with tobacco cessation and sugar-sweet beverage reduction. In our 2022 objective 5, you'll see oral health literacy activities and medical dental integration activities, which are currently in the Objective 9 of the 2017 work plan. In our new Objective 6, you'll see oral health care delivery system quality improvement. And those activities are currently housed in the Objective 10 of the 2017 work plan. And last but not least, our 2022 Objective 7 will consist of activities to create and expand oral health networks. And those activities are largely in Objective 11 in the 2017 work plan. So what's new in 2022 to 2027 grant cycle? The first objective will be established for those new programs or to sustain for our legacy program, local oral health program infrastructure, partnerships, and processes to ensure implementation and evaluation of the work plan. So really, that first objective is really laying the foundation. New programs will obviously need to start by establishing infrastructure if it's not currently developed. And again, our Objective 1 is essentially composed of the first 5 objectives in our original grant. And here again are the 2 major focus areas for our next 5-year cycle. Objective 2, implement evidence-based programs to achieve California Oral Health Plan objectives will be the priority. And again, this objective contains planning steps to support the development of community clinical linkages, school-based and school-linked programs. Objective 3, assess the number of schools currently not reporting the kindergarten oral health assessments and increase reporting via the system for oral health reporting. Will also be another big priority. Objective 3 will also develop and implement a plan to identify key partners to support oral health integration into local programs that work with underserved and vulnerable populations. So when you see Objective 2 and 3, it's really continuing to implement some of those interventions that might have been put on pause due to the impact of the COVID-19 pandemic. Here are a few new activities. Again, quality improvement, coaching and training might be a new element. We're hoping that LOHPs can provide QI coaching and training to primary care offices and CBOs, community-based organizations, to improve services provided to underserved areas and vulnerable populations. And this is an area where CDPH may have resources to support local oral health programs, such as trainings, coachings, and other resources. Also, another new activity will be implementing performance management activities and software. And one of the big things that we've been piloting in the Office of Oral Health is the implementation of results-based accountability. And this will probably be another area that the Office of Oral Health can really provide you some support and technical assistance in implementing. In success stories, we're really hoping that LOHPs can identify new and engaging formats. One such format might be a photo-voice format, in order to really document their success stories and really create an engaging format to share them, whether it's with local programs, policymakers, stakeholders, and the general public, to help sustain program efforts and really tell the story of how impactful and how successful our programs have been. So here's how to apply. Again, our grant application is due December 15th, 2021. A complete application will consist of an application checklist, a grantee information form, a narrative summary form, which is basically asking each applicant to describe for legacy oral health programs. They'll be responsible for describing the progress they've made over the previous 5-year period versus newly establishing oral health programs might be expected to describe the current oral health status of an infrastructure in their community. A governmental payee form, which will help just make sure that we have your jurisdiction's most current and up-to-date information available for when we create our contract documents. And our grant activities and reporting measures. And this will essentially look like a table with checkboxes. And so you'll want to take a look at that. It'll really be the grant and what type of reporting requirements there are in a nutshell. So again, for our legacy oral health programs, they will be responsible for selecting all of the objectives and selecting all of the boxes for those objectives. Whereas there will be instructions for newly establishing local oral health programs on which objectives they will select from that on that document. And again, we have our supplemental application due January 31st, which will consist of a checklist and a detailed budget and justification. So please let us know as soon as possible if for any reason your jurisdiction does not intend to accept funding over the next 5 years. And we highly encourage using our non-binding letter of intent unless there is any extenuating circumstance that prevents you from doing so. After reviewing all completed applications, the Office of Oral Health will notify jurisdictions of the decision to award. And our supplemental submission, we're hoping will allow local jurisdictions more time to complete budget planning and navigate their internal review and approval processes. So again, depending on your particular jurisdiction's review process, you may expect to have to navigate things such as board approval or other review and approval processes beginning in the fall and winter period and throughout the winter and spring 2022. So please let us know if you have any special requests for getting on your board's agenda or any other approval items that might be required. Sometimes we may have to write jurisdictions a letter or provide additional information they can give to their board. So please try to let us know that as soon as possible so we can make sure that that won't hold you up anywhere. Work can be expected to begin on the beginning of our next fiscal year period on July 1st, 2022. So where to get started? Again, please research your Board of Supervisors approval process if you're not familiar. Also, don't hesitate to reach out to your program consultant. And please let us know if you live in a rural or underserved area where provider availability may be a challenge to implementation of school dental programs. We're hoping to create a list of those folks who do have a challenge with provider availability and seeing where our office can support them in increasing access to services and providers. Also, another good place to get started is to review your progress over the past grant cycle and plan for your future and really, look at your CHIP and your state objectives and how you can continue the progress that you've made. We'll also have a process for closing out the current 5-year grant cycle. Just want to make clear to everybody that previous funds will not carry forward into the new grant cycle. So yeah, we'll be resetting in our new funding cycle. So whatever you don't use in this next fiscal year, you will lose. So please take that into consideration. Also, I think Dr. Kumar mentioned this in his presentation that funding has remained stable. And as he mentioned, we did get that funding backfill, so no immediate changes to funding is expected. Coming soon will be instructions on your final progress report and program evaluation. So we will have some more information coming slowly on how you can close out the current grant cycle. And you can expect the activities and the work that you've been doing to continue forward uninterrupted into the next 5-year cycle. And Again, the big idea here is we're hoping to build on your success and continue it forward into the future. And also for those 2 jurisdictions that we aren't currently working with, we hope we can begin to work with them and establish local oral health programs in those 2 jurisdictions. So the next steps is please, if you need to, begin to look into an agenda item for your Board of Supervisors. Also, begin to look towards our non-binding letter of intent, and that will be due by November 15th. But the sooner you can get that to us, I think that would also be appreciated if you want to get that into us early. Upcoming office hours will be scheduled on October 27th and July 12th, 2022. So everybody should be receiving an invitation to those shortly if you have not gotten that already. And grant applications will be due December 15th, 2021, with budget submissions due January 1st, 2022. So please contact your program consultant and copy the dental director mailbox if you have any questions or need technical assistance. And also when you submit your application documents, please send it to those 2 contacts as well. Again, here's a recap of the key dates and application documents. And so coming up next are our letter of intent. And again, we're working forward through this fall for the application due December 15th. And then starting in winter and spring, we'll really begin to execute those grants. So I know that was a lot of information, but we have a panel of Office of Oral Health staff here today. So we have fiscal staff and we have program staff. So now we have about 30, 45 minutes, maybe a little longer. So we'd love to open it up to question and answers. And thank you. I see some folks have already started typing those in. But if you have not done so already, please feel free to type your questions into the Q&A box, and we'll start going through them and answering them right now. So thanks. And Keiko, could we begin to address some of the questions that have been asked in the chat?
Sure, absolutely. Yeah, great. Thank you, Ryan. I know Joanna has been busy answering some of the questions, but I'll go ahead and start from the top. So the first question was, is a board resolution required by CDPH? And I know Joanna has answered that question. And then her question was,
would you be able?
Yeah.
Oh, Keiko, would you be able to read her answers to that question for
Sure,
everybody?
absolutely. So it's only if your LHJ requires them. And this is a follow-up question.
Kimberly, just a moment. This is Kimberly Steele. Hi, everyone. I just want to let you know that board signature or some type of authorization is required for every grant. It's a state requirement. And yeah, that would be required. And those instructions will come when we send you the grant for signature.
Thanks, Kimberly.
Thank you. All right, so following up to that question, it's asking, when do you anticipate that we'll have our contract, as that will be needed to take to the Board of Supervisors?
Kimberly, would you be able to help out with this question as well?
Sure, you bet. Kimberly again. The sooner we get the application submitted, once we get the first application submitted or received, we're going to begin to work on what we call a boilerplate that is basically the standard for all the grants, and to get that approved. So we're really hoping, again, it's going to depend on when we receive the application and if we get any in earlier than the due date. But I'm anticipating in March to have those all approved and being sent out. But again, we'll work with you individually if you guys have any concerns, and but otherwise we would work with them as first come, first serve as we receive them.
Yeah, Yeah, and again, this is like the letter of intent. There is no penalty for submitting to us early. So please feel free to get your applications in as soon as you would like. And again, the earlier we receive those, the earlier we can get started on them. And we'll have 59 to hopefully 61 to work on. So we will be processing a lot of contracts.
Right. Okay. So moving on to the next question. So is the supplemental submission the budget? So it's asking if the supplemental submission is the budget. And the answer that Joanna gave was yes, the supplemental submission will be the budget due January 31st, 2022.
Mm-hmm. Yes, that's correct. Thanks, Keiko.
Great. And next question is, if a county opts out of the funding, does it still stay in the county? For example, funding is offered to a CBO or FQHC. And the response to that is it will be determined if the LHJ opted to not continue. It says, please review the guidelines on page 5. However, it is recommended by the Office of Oral Health Advisory Committee that established LOHP programs continue through their LHJ.
Mm-hmm.
Anything to add there?
No. And
Okay.
and again, yeah, I think what that answer to that question was getting at is we're really, with our funding, we really tried to support the development of public health infrastructure on the local level. So I think that's why you're seeing the preference for building up local health departments, because again, it's this idea that, we're really trying to rebuild a lot of the infrastructure that might have been lost due to budget cuts and other things over the past 10 or 15 years that we've really seen impacted the public health system of California at the local level. So we're really, hoping that we can continue working with the local health departments that we've been working with over the past 5 years.
Great. So this is a little bit of a longer question, and maybe I'll invite Joanna to speak on this. So the question is, I know the work plan on the previous objectives were limited to grades K through 6. If the California's plan's goal, as described by Dr. Kumar, is to provide improved outcomes for pregnant women and young children to reduce caries by 50% by 2030, specifically in school-age children, would you consider adding the preschool population like Head Start and California State Preschools and 0 to 3, such as other school readiness or WIC programs to serve the LOHP? And the next part is that the children are already coming to kindergarten full of caries. Is there a way for us to focus on pregnant women and young children, or at least to include them so we can make an earlier impact? And maybe I'll again invite Joanna to maybe respond to this.
Thank you, Keiko. Yeah, and thank you. Great question, Mary Ellen. Most definitely, the earlier we start, the better outcomes that we're going to have. And it is sad that we are seeing children start kindergarten with this high decay rate or even experience of decay. So with the 2022-2027 work plan, you will see that our strategies are to improve dental visits during pregnancy, because we have some new data on that as well. And we're going to be looking at starting toothbrushing programs in early care, much like Head Start, because we see that that works well. And I can share, maybe after this, I can share some of the information that we have on that, just so everybody is aware. But I believe it was Massachusetts. For some reason, I can't remember which state that is. I always mix it up with Minnesota, but I'm pretty sure it's Massachusetts. They started an early care program, toothbrushing mandate. And, it was a great idea, because they're saying if the child is in early care program more than 4 hours a day, or has a snack during that time in early care, an adult has to help them brush. So, you know, it's a really, really great thing that they started in that state. And we'd like to see something like that happen in California. We want to continue working with the medical and dental integration. We want to work with primary care providers because during those well child visits, you know, they're seeing the child 0 to 5 more often than we are seeing them in the dental office. And when we want them to, you know, do a screening, make referrals if needed, and apply fluoride varnish applications so that we're getting those fluoride varnishes on 2 to 3 times a year, as it's that's the evidence that we have. And then you'll see in your work plan that, you know, we wanted to include developing partnerships with more of these community-based organizations or other programs like Mary Ellen mentioned WIC. So yes, all of those are fantastic ideas, and most definitely we do want to include pregnant mothers, expectant mothers, and the kids 0 to 5. And hopefully, I don't want to take up too much time here, but you know, we are excited about this work plan, and we will get into the details as we start to move forward. And we're this is definitely a priority, and we're excited to be working with you all. I hope that was helpful.
Great, thank you, Joanna. So the next question is, will the Office of Oral Health provide a template for the letter of intent, or do we just create something at the local level on the letterhead and submit it?
Yes, we actually
Yes, it
have,
has.
sorry.
No, go ahead, Joanna.
Okay, sorry. With the email that we sent this morning and then the link to the COTAC website where all of the documents are located, it's Appendix 15 and it says letter of intent. So Appendix 15.
Great, thank you. And this is, I think, just needs a little bit of clarification. They're asking if the letter of intent is due on November 5th or November 15th.
Did we put something wrong in there? Sorry, let me double check it. So this will be due November 5th. So sorry if we had something marked as the 15th. It's that form appendix 15 is the outline, and it's for November 5th.
Great. So the next question is from Nancy Starr. She's asking, does the key partners in Objective 3 refer specifically to the kindergarten oral health assessment?
Yeah, Objective 3 has a couple of sections. So, you know, it's Objective 3 starts with COA. And then we sort of expanded this idea of working with partners to promote oral health. You know, we're trying to develop and implement, you know, these different preventions and healthcare policies and guidelines and expand all of this. And so you'll see with Objective 3, COA is a high priority. And then developing these partnerships starts with 3.2. So you'll see that it talks about developing and implementing a plan to identify and recruit key partners. And there's a list there. It's not an exhaustive list, but it would be a great start working with the County First 5 Commission, you know, the County Office of Education, WIC, Head Start, Early Head Start. And so there's a nice list there. And again, you know, a lot of this we can really get into the details, but maybe we'll save the details for another time and just do the highlights. Or you can reach out to me individually and we can discuss it a little bit more.
Great, thank you. So next question is, would there be any changes to the budget template and the budget modification template for the next funding cycle?
Hi, this is
Kimberly.
Kimberly. Yeah, you bet. It's very slight changes. It's really primarily the same. We try to improve it somewhat, but it is the standard one, and it's very similar to the one that you all are used to.
Great, thank you, Kimberly. Ryan, did you want to add anything to that?
No, besides the fact that it is a little bit more streamlined and improved, so I think everybody will like some of the recent changes made to it, but it'll be very familiar, I think, to all the programs that we've been working with.
Great. Great. Okay, so the next question is referring to the administrative costs and the indirect costs. Could you please elaborate if the administrative cost still applies to this cycle?
Hi, it's Kimberly. Yes, there has been no change. The statute that is being referred to is there's a 5% cap on administrative costs. I know we've had a lot of questions about that, but it doesn't, I just want you all to know, it doesn't necessarily equate to your indirect cost rate. However, it has to be followed, and it has to be complied with it. So what I'm suggesting, and you can certainly contact me directly for more information, but we really are not able to provide more than what the statute shows. And the statute's, short and clear, and I can provide that to you all if anybody wants to reach out to me. But what I recommend is that you talk with your accounting and your Office of Legal Services to have them review the statute to ensure that each program is in compliance. It is required, and I can also share with you all, we've done this in a prior webinar, but we can share, what the state has identified as the cost that we are calculating, because we calculated at the state level also. But each indirect cost rate, is approved through the department approves those, but that doesn't tell us what's included in the indirect cost rate. So that's going to be very specific to each local oral health program and what's included that you charge to your indirect cost rate in that section of the budget. So I highly recommend you go back to your accounting to identify what is included in the indirect cost rate, and then talk with your legal services to ensure that there is compliance.
Great, thank you, Kimberly. So we have a little bit more of funding questions. So the next question is, in the new funding cycle, can we carry unspent funds forward? For example, for fiscal 22 to 23 to carry over to fiscal year 23-24.
Kimberly again. So we are not allowing any funds to transfer from one grant to the next. The new grant will, as Ryan had mentioned, it's going to be the new funding, and no money will go from one term to the next. However, we do anticipate allowing carry forward like we have been over the last several years. Barring any funding changes, which, as you may have heard with Dr. Kumar, we were excited to learn that we got backfill. So we anticipate getting our full funding, but that is never guaranteed. But it looks very promising, and we don't anticipate any problems at this time. So we will allow your year one to roll into your year two following what we've been doing since. And I hope that answers it.
Great, thank you, Kimberly. This is also another, funding question. And it's asking, if a LHJ declines the funding, will CDPH distribute those funding to other LHJs?
Thank you. Good question. And no, we do not plan to do that. And we really hope that there's none that are going to decline the funds. If that is something you're thinking of, or you have concerns, we really want to talk with you. Please reach out to either your program consultant or any of us, Joanna or myself. We'd really like to sit down and talk that through a little bit to see what the challenges are, see what other options there may be. But we really hope that the work continues because you've all done such a great job, and we're only just beginning. So, but we will not redistribute the money, and you may be referring to the last RFA where we did we took what funding was remaining and redistributed it. But that'd be a little too complicated and too much of a challenge for us to do that this time. So no, the funding that's set, you'll see that in the funding table that was part of the attachments. That will be the funding, and that'll be unchanged.
Great, thank you, Kimberly. So the next question is more of the objectives question. It's asking, under what new objective does community water fluoridation fall under, or will this no longer be a grant-related objective?
Mhm. Yes, and I did respond on there. So for community water fluoridation, it'll be in objective 2 of the 2022-2027 work plan, and it starts at 2.4 on page 15 of that work plan.
Yeah, and I think you'll see in the new plan for smaller jurisdictions, especially, less of an emphasis on necessarily, advocating for fluoridation for all jurisdictions. We recognize that, different jurisdictions might have different challenges. So I think what you'll see in our new work plan is a little bit more flexibility for jurisdictions with a smaller amount of water connections in their local water districts.
Great, thank you. So the next question is asking, if a partner agency has developed or implemented a type of care coordination platform for CBOs and PCPs to refer, are LHJs expected to create a new platform or expand on that?
I saw that message, and I wasn't exactly clear on what she was asking. Partner agency.
So maybe we can come back to that.
Okay, I asked her to explain it a little more. So yeah, just remind me,
Sure.
Caitlin, if you can respond, just so that I'm answering it correctly and I understand what she's asking.
Sure. And this is a program question. It's saying schools have reported that a barrier to entering COA data into SCORE database is the cost of personnel to do this work. Will the local oral health program be able to provide a stipend or incentive to certain schools with higher free and reduced lunch plans to promote data entry?
It's always a really difficult question to answer. I might ask Rosanna to chime in because she has a little bit of history about the COA law that we have and how it's funded for the schools.
Hi, this is Rosanna. I think what Joanna is referring to is initially when the law was passed, there was a specific amount, but then when the State Department of Education and addressing local control developed a new system of funding where all their funding is pooled, and they develop a local control funding plan using a local control funding formula. And as part of that, if community members, parents, or stakeholders attend those funding discussions, that they can advocate that funding for COA completement, doing the forms, or personnel be dedicated for that purpose. However, we are interested in discussing more with you about a proposition or a pilot project, perhaps, if interested. So please let us know either before you submit your application what the potential incentive or pilot project you'd like to start. And if you can contact Joanna and myself, that would be great.
Great, thank you, Rosanna. And this is also another program question. It's asking, is it suggested to provide preventive dental screenings and varnish in pre-K programs, or focus more on elementary school age children for the actual school-based programs?
Keiko, I'm sorry, I was following along with these questions and then I got, I think I
Sure.
was answering a few and I got a little bit behind. So, okay, here it is. Is it suggested to provide preventive dental screening varnish and pre-K programs? Okay, or focus on elementary. Yes, so the focus will be for the elementary school age school-based programs. So like through the webinars that Dr. Bahara Manzadeh had presented, there is a plan to help the LOHPs choose a model, a school dental model that could be starting with referrals, like screenings and referrals. It could be graduating to a sealant program with referrals, or a more comprehensive school-based program where some of the providers are actually doing all preventive services and sometimes providing some comprehensive actual treatment. So yes, this will be a focus on the school-based dental programs. With that being said, the pre-K programs, what we're looking for is that we would want to partner with primary care providers in your area so that they can do the screenings and provide fluoride varnish and referrals if needed. And for that younger age group, toothbrushing programs in early care, their early care schools.
Great, thank you, Joanna.
Mhm.
So the next question is coming from Napa, and I think this is more of a collaboration question. And the question is, would there be an opportunity for a new county to engage with legacy counties of similar size to discuss their 2018 through 2022 project scope, budget, staff time over the 5-year work plan? Saying we'd love to get more perspective before the letter of intent is due.
Yeah, I think that's a great idea. So I can follow up with Erin and reach out to a few of the legacy programs so that they could meet up and discuss these. It is nice to have a peer perspective of what's been done and what they're working on and how they went about things. And yeah, it's amazing. It would be amazing to get that perspective. So Erin, I'll follow up with you, and I think that's a great idea.
Okay, thank you. So the next question is for the software. It's asking for the community linkage objective. Will CDPH continue to approve the software cost?
Okay, sorry, I was writing myself a note. I didn't keep up very good with that. Let's see.
Sure.
For the community linkage objective, that one, will
Yes.
CDPH continue to approve software costs?
Yes.
Yes. So when we, I think this is talking about the referral management software. And if that is correct, then yes, the Office of Oral Health is working to procure a software that we would have enough licenses for all of our LOHPs to utilize, but it doesn't mean that you have to pick the same one that we do. So there will be allowances so that you can choose a referral software system that works best for you. But we're hoping to have one so that it would ease the cost and make it readily available and shared. That process will likely take about a year. So there won't be a lot of information about it until we can get it approved through CDPH, and then we can share more information about which software it is and how it'll work. But I know that in initial discussions, there would be enough licenses for providers in the community as well as the LOHP project directors to utilize the system. And then, but there's always, some of the LOHPs have different models of care that they're looking at, including like a virtual dental home. And there's specific softwares that tend to work best with those, like Teledentix. So yes, we can approve the software cost for that.
Any other questions, Keiko?
Oh, yes. Sorry about that. I was on mute. So the next question is if you can elaborate on sponsorship, Appendix 12. It's asking if this is a separate funding. For example, if LHJ sponsored dental screening event for going back to school, do LHJ fill out separate requests or does it get built into the budget ahead of time?
That is a good question. What do you think, Kimberly?
There's not extra funding. There's not separate funding for that. So it would have to be part of the funding that's received. At least at this time. We may have special funding at some point, but there's no current plans for additional funding.
Great, thank you. Any other questions? If people still want to write in, we still have a lot of time.
This is Kimberly. I do see a question or a comment in the chat regarding the current template. The justification tab needs the capability to match line items by fiscal year. You know, this is something that we can work with you directly. I know everybody has different, I guess, can work with Excel differently. Some people have no problem, others it's a little more difficult, or maybe you just find our template a little difficult, but we're happy to work with you. What you can do is, as you're building your budget, you know, we hopefully we've given enough time to build that, but we can certainly work with you directly. You can email the dental director at cdph.ca.gov and your grant manager and possibly myself. We can work with you directly to help you with anything. You know, I know that some people are used to other templates and there may be something else, but this is the one we're going to use for this round. We have thought about and looked at making improvements, but at this point, this is the template we're going to be using and going forward with. So, but we're happy to provide technical assistance if you have any challenges with that. I also want to say that I added into the chat, if you want to take a look there, regarding the admin cost statute that was referred to earlier. And that is Revenue and Taxation Code 30130.57F. And that's the statute that it states not more than 5% of the funds received pursuant to this article shall be used by any state or local agency or department receiving such funds for administrative costs. And again, this is where I really want you to talk with your legal. They should be reviewing the statute and ensuring compliance. Your accounting may get involved to ensure that, to identify what costs are being included so that that can be determined. But if, we can certainly talk offline if you have any questions.
Great, thank you, Kimberly. So moving on to the next question. And Angela Martin's asking, do you know what the name of the software that you'll be using for referral management? And I know, Joanna, you already answered this question, so maybe I can invite you to speak on this.
Sure, sure. Yeah. With the software, the procurement process is going to take us a little while. So we just begun the process, and we have to get approval from the agency first. And then once we have that approval, we can let everybody know what the name of the software will be. But it'll be very similar to the webinars that we had. We want those components available so that we're ensuring this referral process. And even though the Office of Oral Health will be procuring the software, you can also use your LOHP grant funds to add components. Let's say that as you're using it, there's a component that you would find useful, but maybe it's not included just yet. You could add components.
Great, thank you, Joanna.
Mhm.
Okay, so next question, it's asking for legacy programs, are the budget revision dates stay the same, April and September? What about invoice dates?
So we did include the schedule of deliverables, and I don't believe any changes to that. So that would still be the standard. We went invoices on a quarterly basis. We didn't change any of those timelines. We gave 60 days for invoicing after the quarter ends, and then 90 days following the end of the fiscal year, so that gives sufficient time to close out everything. But there shouldn't be any changes to that.
Great, thank you, Kimberly. So the next question is, are there any plans for the state to support the local oral health programs when facing complications internally from the county when trying to move Office of Oral Health approved activities forward? And I know, Joanna, I know you're answering this question, so maybe I can invite you to speak on this.
Yeah. I'm not exactly clear what the complications internally might mean. So, and carefully answering this, I would say, depending on what that meant, you are always, please feel free to reach out. We're always here to help. If you're facing any complications, please reach out to us. We'll set up an appointment. We can talk through it and just see, how it is that we can help. I know we've had some special requests, for instance, with like workforce issues in their jurisdiction. And Dr. Kumar has a plan in place, and he's working on things like that. If it's a complication with procedure-wise, that's an LHJ procedure, again, we would have to talk about that. So without not understanding exactly what the complications may be, please know that just to reach out, we'll set up an appointment and we can discuss it. And definitely, we're always here to support you and help you find answers to the questions that you have, and ensure that we are moving forward with our activities so that we're achieving our goals.
Great, thank you, Joanna. And I think the next question, you also answered this, but it was asking on, will we still be able to use grant funds for the kindergarten oral health assessment incentives, as we have been allowed to do this this year?
At this time, there is some discussions about potentially a reimbursement, small fee. I think they're looking at around, well, I shouldn't say because I have no idea until it's approved, but a reimbursement fee for dental screenings. But until that happens, because that is not a reimbursable procedure, we can support stipends for those dental professionals in your area. That's going to help complete the kindergarten oral health assessment. So yeah, follow the guidelines, and we will continue that until that is an approved reimbursable service.
Yeah, and considering, our supported screenings too, I encourage folks to really look at objectives 2 and 3 and, identify ways that there might be a lot of synergy between some of those activities and new initiatives in those objectives. So hopefully a lot of the work that you'll be doing in those objectives can support and reinforce each other too. And hopefully those stipends will help folks increase the rates of COA reportings and screenings in schools.
Mhm.
Again, we still have a little bit more time, so please go ahead and put your questions in the Q&A box.
And Keiko, I see one more in here. It says the instructions were clear that the stipends need to be in the budget revision, but there was an additional instruction that were a bit confusing. And it was the quote from number 2, submit a stipend request to your program consultant and CC the dental and director, include these things. And so, yes, we still need to approve the stipends and the cost. So when you read the guidance, as stewards of the money, we just want to ensure that how we are spending and allocating the money, that it's going to be the most impactful, and we're working towards our goals. And so you can imagine that we will need to have a record of how the money is being spent, what it's being spent on, and what the impact is. So when you submit your request to your program consultant and include this information, this helps us understand how much it's going to cost, how many kids are going to be screened, and how impactful that is for your area. And I hope that makes sense.
Great, thank you, Joanna. Okay. And I guess this is a clarification question. It's from Primavera. She's asking to clarify, the incentives are for the dental partners or for parents to turn in the completed form to the schools after seeing the dentist? So that's a question.
Sorry, I was just typing this out to make sure that was a little more clear, but tell me that one more time.
Yes,
Was
so
it about the
she's-
stipend?
Yes, she's asking for asking about the incentives. Is that for the dental partners, or is it for the parents to turn in the completed form to the schools?
The incentives of dental parents. Oh. That was from a question about somebody asked if they could provide incentives to increase that COA reporting and participation. So we do have some guidelines for spending the funds with the behavior modification. And I think it's pretty clear in there that we can use the money to, as an, I don't know if incentive's the best word, but to increase the participation and reporting for activities like COA. But there are some guidelines about how much that can be spent per person per year. And that document still exists on our Office of Oral Health webpage, but I can see if I can attach it here in the chat. But
Yeah, so kind of piggybacking on what Joanna just said is that what we were talking about in the previous conversation was stipends for screening, whereas I think Joanna just mentioned that your behavior modification materials guidelines, you'll want to review those to look for incentives that could be provided to folks such as parents or others to increase participation in COA, but in particular, the stipends that we were referring to were for professionals to screen children.
Oh, I see. I see what they're asking. Okay. Okay.
And, uh, and there's a question in the chat.
Okay.
I think it's asking, can the questions and answers addressed in this meeting be provided in a written format? And I think, Joanna, you were, and Ryan, you were talking about having an FAQ
Yes.
from this webinar.
Yep, we'll definitely do that. So we'll have the PowerPoint, the recording, and then we can develop an FAQ, and we can add to the FAQ for each office hours following this so that we can have a reference to go back to. That's a great idea. Thanks, Alan.
Great, thank you. The next question comes from Jennifer. It's also related to stipend. How do the stipends work and what are their limits per day for the dentists?
So we did not limit exactly, the cost of stipends for the dentist in our guidelines. We just asked that the work that's being done is impactful. So we're seeing for the there's a breakdown of percentage of kindergartners screened with the hopes that at that minimum, the minimum for those for the larger counties was 60%. For some of the smaller counties, it was 80, and then you would build on that. So our goal is to reach and screen all kindergartners in your area. And we were just asking that whatever plan that you come up with for that and the stipends provided, that it wouldn't go over 10% of your budget. So your annual budget for your LOHP, that didn't include the rollover. Jennifer, just let me know if that makes sense. Some people were paying the provider per hour based on a number of screenings. Some of them were providing a stipend, just a flat rate per day. And it might just be a conversation with that provider to see what they may prefer so that you can kind of plan that out.
Okay, great, thank you, Joanna. And also another stipend question. This comes from Angela Martin. She's asking, is a stipend for professional services the same as an honorarium?
In some ways, well, they are two different things. And in this case, we decided to call it a stipend. A lot of times the honorarium are for, well, I come from a background where I worked in a university. And so when you would have guest speakers or something like this, usually provided them an honorarium. So I don't know if anybody knows the definitions of the two, because I don't really offhand, but in this case, the stipend made more sense for the actual service that was being provided by the professional.
This is Rosanna. A stipend isn't meant to completely pay for their services. It's an amount to say, here's something to help with your efforts, but not to pay their salary. Mm-hmm. And the honorarium is often given when you're doing presentations or providing technical assistance, and it's not at your usual going rate, but something to acknowledge that you are providing a service, even though you don't have the funds to to support it completely. So it's more of like honoring more of a voluntary effort where it's not really per fees, or they don't charge their regular fee.
That's helpful. Thanks, Rosanna.
Great, thank you. We still have a couple more minutes. I think we can answer a few more questions.
I was trying to read through here, make sure we didn't miss anything. I do see a question in the chat. It says, will media projects be streamlined so that all counties are promoting the same? You know, and that's a really good question, and that's been brought up in the past. And we are trying to encourage, messaging that is the same, so that we're sharing consistent messages throughout the state. We partnered with Smile California for the Back to School campaign, and they put together a wonderful campaign with the ability to co-brand and things like that. So at the same time, you know, every county can be very different, and we were still allowing for the ability to submit your media requests, your messaging for approval. But sometimes, like especially after the needs assessment, different LOHPs found that, you know, they needed to target these gaps that they discovered, and not necessarily, they didn't necessarily want the Office of Oral Health to tell them which messages were needed for their county. So, you know, we're trying to be open to that, so that as you find a need, you know, you can, or a resource that you found, you're thinking, oh, this would be perfect for this school or for this project that we have. So we'll continue to try to put together some standard consistent messages for everybody to use, but we are open to you submitting your media requests and messaging for approval, so that if you find a need, a specific message that needs to be shared, you can continue to serve your county in that way.
Great, thank you, Joanna. So I have another question in the Q&A. Will the state have a collective evaluation plan or activities for each objective?
Say that one more time, I'm sorry.
Sure. Will the state have a collective evaluation plan or activities for each objective?
Yes, so we'll continue with the evaluation plan from this first cycle that you can revise in the second cycle based on, you know, the new activities and things that are needed. And we're going to, so for this ending cycle, we're going to send out some instructions so you can complete an evaluation, and then we'll do something similar for the new cycle. I think I'm answering that question correctly.
Yeah, and one thing to note too is when you look at the new work plan is we are going more towards a model where we're going with one set of collective work plan activities rather than you know, we're hoping that, you know, we don't get requests for changes, because yeah, I think one of the things that we learned from our previous 5 years experience was the need to develop the work plan so it could be flexible for different communities' needs, but also wanting to have a model and a framework that is the same for all of the jurisdictions we work with. So I think when you look at the new work plan, you'll see that it was written intentionally to offer that sort of flexibility to different communities and geography and demographics, while being able to maintain a set of collective activities that will not change for the most part across jurisdictions.
Great, thank you. So we have just about 1 minute, and I don't see any other questions in the Q&A or chat. So maybe I'll go ahead and move this back to you, Ryan, for the closing remarks. Oh.
Yeah. Well, sorry, I cut you off there.
Yeah, no, sorry about that. Just one last question that came in, sorry, from Cherry Sprouse. Goes, will the activities be evaluated the same across LHJs?
Joanne, do you want to jump in that, or should I take this one?
Well, you could help me. I think that, again, we try to provide some autonomy for some of these activities. And so that we do want to evaluate the work plan that includes the objectives and the activities, so that we can have a collective response and outcome, and look at what has worked and what maybe hasn't worked. That's the good thing about evaluation. Sometimes we identify those things that we need to improve. So with that being said, we usually let the LHJs write their evaluation questions, depending on, the indicators that they're tracking, and some of the things that they're looking at. But that's a great suggestion in a way. One of the things that we could talk to our research team about, the evaluation team, is having, we had some sample questions from the previous cycle, and I think some of the LHJs found that helpful. So we could have more sample questions. That way, if you're struggling with coming up with a few evaluation questions, you could use these predetermined ones. But in the end, yes, we're trying to evaluate all of the objectives in the same way. We want to know what's working and what's not working. What do you think, Ryan?
Yeah, and I think one other thing to add is that the state does have common performance metrics, like those of you will see in the data form that you submit, as well as a common framework for evaluation, and elements that make, proper evaluation plan, how to conduct an evaluation. And there's also flexibility to understand that different communities might have different specific needs, as well as, acknowledging differences in the size of different jurisdictions, racial ethnic composition, demographics, geography. So yeah, we are, we will have instructions for an upcoming evaluation at the end of this 5-year cycle. And again, we're hoping to have some, we do have common statewide metrics and common statewide frameworks, while we also try to avoid comparing apples and oranges. So it's, again, the kind of balance we have to strike with allowing, flexibility for the needs of different communities while having, statewide metrics and framework for conducting an evaluation on that scale.
Great, thank you, Ryan. Now I'll go ahead and turn this back to you for closing remarks.
Yeah, thanks, Keiko, and Keiko, I want to thank you and COTAC and for being a big part in scheduling and hosting this information session, as well as the Office of Oral Health team. And I want to thank everybody for joining us today. We're very excited to be sharing our new work plan and request for applications with everybody. This has been a lot of hard work in the Office of Oral Health. And again, we really want to continue to improve our program, and with new evidence that comes along, new technology, and continue this to make a great impact in the state of California. We've been very happy with the way our local oral health programs have made a difference in their communities, and we want to continue to, do some of the great work that we've been doing. So please reach out to us and please let us know how we can support you. As a program consultant, I want to, make sure that I am offering the best level of customer service to the jurisdictions I'm working with, and I can say for the rest of our team, we really want to be here to support you during this application process and answer any questions that you might have. So thank you for joining us, everybody, today. And please join us soon for our upcoming office hours session, and let us know how we can support you. Thank you very much, everybody, and have a great afternoon.
Have a great afternoon. Thank you all for joining.